Good evening. Welcome to Sound Health on Lagos Television. I am Ola Sumbo Mudupe. The World Health Organization says global cancer cases is expected to rise by 77% in 2050. How do we ensure we reduce the risk factors and what are we expected to do? Today, our special focus is on ovarian cancer. Please stay tuned. The conversation begins after this break.
Ovarian cancer is a subtle disease. It can sneak up on us like a thief in the night, disguised as common problems such as prolonged bloating, the constant need to pee, and fatigue. While the warnings are the same, the most common type of ovarian cancer begins in epithelial cells, a type of cell that makes up the tissue covering the ovary surface. To best treat ovarian cancer, doctors at Roswell Park first confirm the diagnosis and learn the stage or extent of the cancer. This requires a procedure called surgical staging, during which a surgeon carefully examines your pelvic and abdominal areas. The stage of ovarian cancer is determined by where cancer cells are found in the body. In stage 1, ovarian cancer is found in or on the surface of one or both ovaries or fallopian tubes, or in fluid collected from the abdomen. In stage 2, the cancer has spread from its initial site to other areas of the pelvis, such as the ovaries, fallopian tubes, and the uterus. Finding cancer only in the lining of the abdomen is also considered stage 2. Stage 3 means that the cancer has spread outside the pelvis and is found in other parts of the abdomen, nearby lymph nodes, or on the surface of the liver or spleen. The cancer has reached stage 4 when it's spread beyond the abdomen into other parts of the body, such as the liver, lungs, bones, or in the lymph nodes in the groin. At Roswell Park, we have a highly experienced team of board-certified gynecologic oncologists who focus specifically on gynecological cancers. Know your body. Ovarian cancer whispers. So listen.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Bolanle Adegboyega, a consultant radiation and clinical oncologist at the NSIA-LUTH Cancer Centre with over 10 years experience of treating cancer patients with special interest in female cancers, genitourinary cancers, adolescent cancers, and palliative care. Good evening, Dr. Adegboyega, and thanks for joining us.
Good evening, thank you for having me.
All right, Dr. Adegboyega, today we are looking at ovarian cancer. Recently, the World Health Organization released some data. The World Health Organization says cancer cases will increase by 77% in 2050. What are your thoughts about this recent data by the WHO?
Thank you once again. So actually, cancer is on the rise. Also globally and also in Nigeria. So essentially because we are more aware, people are screening more, there's advances in science, new discoveries. So things that used to be termed as unknown disease or attacks here and there are now diagnosed as cancer. So all these then are changes in our lifestyles generally, changes in the environment generally, has actually contributed to the rise in cancer incidence.
Okay, our focus today is on ovarian cancer. We have seen people come up with cervical cancer, lung cancer, but we've treated that in the past. But we are looking at ovarian cancer today. Tell us, what exactly is ovarian cancer, and why do people mix up cervical cancer with ovarian cancer?
Thank you. Ovarian cancer is the cancer of the ovaries. Ovaries are only found in females. Those are the eggs that produces that get fertilized with the spermatozoa and leads to fetus, people getting pregnant. So generally, every matured women, ladies, are supposed to ovulate. That is, one egg or two eggs released every month, which, if fertilized, can actually lead to pregnancy. So some people that are not repeated exposure, repeated ovulation is actually one of the predisposing factors to developing ovarian cancer. Unlike cervical cancer is a sexually transmitted disease in a way. So it's actually associated with sexual intercourse, unsafe sexual practices, human papilloma virus. So it's actually commoner among those that are more sexually exposed, whereas ovarian cancer are commoner in more elderly people. So it's commoner in the cervical cancer is commoner in the younger age group in quotes. Ovarian cancer is commoner in the elderly people as people are aging, and at the same time, because of repeated exposure and several times of ovulating, getting pregnant or not getting pregnant. So in a way, they are not the same. The only thing that may actually make them to be a bit close is that both of them can present with abnormal vaginal bleeding, either postmenopausal, at least in both cases. So it can be confused, but if further tests are actually done, they are not the same. Cervical cancer is from the cervix. That is the mouth of the womb. That is the place that gets dilated when women are in labor, about to give birth, whereas ovarian cancer arises from the ovaries, the eggs in women.
Okay, ma. You mentioned earlier in your response that regular ovulation is one of the predisposing factors. Can you please be elaborate about this?
Okay, so ovarian cancer, getting pregnant is actually protective in ovarian cancer. When you are pregnant, it means that for those periods of 9 months or thereabouts, you are not ovulating, eggs are not being released. So in that case, it's a protective case to developing ovarian cancer. So people that are more fertile are less likely to develop it compared to the counterparts who are either nulliparous, no child at all, or have fewer children. It shows that the ovaries is working much more when you are not pregnant, when you are not having more children, compared to those that have many more children. So the more you ovulate, the more the eggs are being released, the more the chances of developing ovarian cancer.
All right, thanks for that explanation and clarification. So let us look at ovarian cyst. We hear ovarian cyst. Is ovarian cyst also a symptom of ovarian cancer?
Okay, so ovarian cyst is a benign swelling in the ovary, like water collection in the ovary, and is actually common in the younger age group. Ovarian cancer is a malignant. That is when this ovary actually has changed to cancer. So there are different things. Ovarian cyst is benign, it is not a cancer. Only that at times when we are doing screening, when you look at an ovary that is cystic, that has water, there's a way the water looks that can tell you whether it is cancer or not. So this is for the radiologist when somebody has done either ultrasound scan or CT scan to determine whether the way the cysts are looking, they are plain, they are looking straight forward. Whereas in cancer, they are usually joined together, they're a bit more complex in cancer compared to simple cysts.
Okay, thank you so much, Dr. Adegboyega. So apart from regular ovulation, are there other symptoms a lady must watch out for or look out for?
Okay, so talking about symptoms of ovarian cancer, like I said, the major one is age. Ovarian cancer is actually commoner in the elderly, above 60s and above. Those are people that usually have it. It might occur in younger age groups, they are younger, and they are not as rampant as the elderly. Another thing that is common to ovarian cancer, another predisposing factor is the family history. So if some cancers runs in the family, it might be a pointer to that there are some changes, there are some abnormalities in the genetic composition. There's a particular gene that is responsible that we call BRCA gene. It is breast cancer gene. So this is found, there are two types. It's found in those that have breast cancer, those that have ovarian cancer, those that have colorectal cancer, some in prostate cancer, some in pancreatic cancer. So if you have anybody in the family, especially close family relations, like parents, mother, like a sister, like first cousin, like your aunts, and your grandmother, they are close family relation. That if any one of them has developed either breast cancer, ovarian cancer, or colorectal cancer, it is a pointer that you may need to check to be sure that this does not run in the family. Talking about presentation is actually one of the cancer that can be very difficult to diagnose. Why? Because its presentation is not as specific like most other cancer. Unlike breast cancer, when somebody has a swelling in the breast, you know that okay, maybe there's something wrong here. The ovary is inside the abdomen. So there are so many organs there, and then there are so many things that can be wrong there before you actually point it to ovarian cancer. Some of them, it might just be weight loss, and you know weight loss is not specific to ovarian cancer. So many other things can actually lead to weight loss. Some, it might just be feeling of weakness. Most other cancer, other complaints, other conditions can also give that. Others is feelings of feeling full easily. When you eat a little food and you are actually full and you are feeling bloated. Others might actually be the abnormal vaginal bleeding, like I mentioned earlier. It might be abdominal pain. Some of them, when it is actually affecting other organs, it may lead to backache. When it's getting bigger, it may lead to leg swelling. It may lead to abdominal swelling. So at times, there might even be some swellings in the abdomen, like nodules in a specific place around the umbilicus nerve in women. So it's not a specific thing. So it's just a combination of several non-specific symptoms. So it makes it a bit difficult to detect and lead to people presenting late compared to other cancers.
Okay, compared to other cancers now, there are precautionary measures. For instance, in cervical cancer, you're expected to get vaccinated against HPV. Yes, and you're also expected to go for regular screening. Is this disease preventable? How do we reduce our risk factors? Because the World Health Organization also said 1 in 75 women will have this cancer in their lifetime.
Thank you. So in this case, like I said, it's not so specific. The one of it is knowing your family history. So it's not a good one to say you don't send what happens to your immediate family, your close relative, because you are in Lagos, there in the village. So it might be for your own good to actually get to know when grandma or your aunt is not feeling fine. Try and dig more what is the issue. So if you know what runs in the family, it's not just enough to say my aunt died of this, my first person died of this, but you didn't bother to find out what. So know your family history. So what we're trying to do as much as possible is that when we also have patients with breast cancer, ovarian cancer, colorectal cancer, we try to go further to do genetic counseling, do BRCA testing, because this might be a cause. So when we know that the BRCA test is actually positive, we counsel them to get their immediate family members and close family members to get screened. So when you know these runs in the family and you're able to go further to do the screening, you know whether you're at risk or not, and in that case, you might actually take some precautions in that area. Unfortunately, these tests are quite expensive, so some that even need it may end up not doing it. Another one is that if somebody has had ovarian cyst, so you have had any surgery whatsoever, it's not just enough for you to say, because some people are maybe in private setting or stuff, they do the surgery, they will not take the sample to the lab to detect what it is. Some doctors, in quotes, might just say that this does not look cancerous, so they just discard it. Anything that is removed from your body must be sent to the lab for the histologist to look, pathologist to look under the microscope and tell us, because you never can tell. You might think it's a straightforward ovarian cyst, there might actually be some part of it that can actually be malignant. Apart from that, for women that are 40 years and above, annual screening is actually good for you. So when some things might just be detected by chance, really, you just did an abdominal scan when you're looking for it and you found something is wrong somewhere, you may help you to do further testing and they help us to detect early. Another one is when you are not feeling fine, it might not be specific like I said, then you have treated malaria, you have treated typhoid like people usually do, you are not getting better. It might just be good for you to escalate it, go to the hospital. If you are in the hospital, you are not getting the best of care, it's no harm for you to seek for a second opinion. So those ones are, so it's not, at times you to get stories like that. They have done mirage of tests and then they found nothing, and you are still not feeling fine. So it might just be necessary for you to seek for a medical expert somewhere else. In another, if you are in a general hospital, if you are in a primary health center, it might be good for you to go to a teaching hospital where we have more testing being done. So these, among other things, can actually help reduce the incidence and late presentations.
Okay, we've seen some women remove their ovaries and they say, well, I am not open to diseases like ovarian cancer, cervical cancer, and other similar diseases. Does removing one's ovaries reduce the risk?
Yes. Why? Because ovarian cancer develops primarily from the ovaries. So at times, to a reasonable extent, if ovaries are removed, it might actually reduce the risk. But the question is that why was the ovaries removed and when was it removed? So if the disease is already there, before somebody gets to remove the ovary, you might discover that the cancer has actually spread beyond the ovary before the ovaries are actually removed, or it's not coming primarily, it might be from the fallopian tubes. So it depends on why the ovary was removed and what for. But more often than not, if ovaries are removed for the right indication, it might actually be a preventive measure. And that is the age. Why? Because removing the ovaries too at an early age, we send the person to an early menopause. So, and it also has its own side effects. So then it's well done and rightly done, it can actually be protective.
All right, Dr. Adegboyega, is this disease treatable? Is ovarian cancer treatable?
Yeah, generally all cancers are treatable. So we talked about, is it curable or not? So cure in cancer is actually commoner when cancer is present early, and that is what we're advocating. Early cancer is actually seen when people go for routine screening, such that it just be discovered incidentally, or it's discovered when the symptoms is just barely starting. So stages 1, 2 cancers can actually be treated and cured. But by the time cancer has spread to other sites, then we can only manage it. We cannot talk about cure, because then we treat it for a very long time, like a chronic disease like hypertension. Why? Because it keeps coming back and keeps coming back. So ovarian cancer is treatable and can be curable if patients present early.
All right, your call to action as we wrap up this segment now, Dr. Adegboyega.
Okay, so like I tell women generally, like every other person, women are the one facing most of these challenges to a reasonable extent. Ovarian cancer is only found in women. We are the only ones with ovaries. So it can just be a birthday gift for yourself. Annual medical check, especially when you're 40 years and above. Set it around that time and get yourself screened. Don't wait till these symptoms start and then most of them are gotten out of hand. And by the time you found something abnormal in your body, don't assume it is an attack. I'm also a Christian, we go to church, you're also a religious person. As you are doing it religiously, seek for medical opinion and get treated on time. Cancer should not be a death sentence. And a lot is happening, we're changing the narrative. If only people could come out early, it's far easier and it's far cheaper to prevent and treat early disease compared to when it has actually metastasized and spread.
All right, thank you. Thank you so much for that encouragement. Where can a woman actually go for screening? Because in this part of the world, access to healthcare can be very challenging.
Okay, so I'll say screening is far more accessible than what we used to have. Most general hospitals, there are many diagnostic centers, there are plenty teaching hospitals all over Lagos and even outside Lagos. I work in the NSIA-LUTH Cancer Centre, which to a reasonable extent is a one-stop cancer center. We have diagnostic inside youth. We can give genetic counseling. We treat, it's actually a state-of-the-art cancer treatment center in Lagos and in the whole of West Africa. So places like this are where you can get the right, you can get access to either screening or treatment and we refer appropriately. So NSIA-LUTH Cancer Centre inside Lagos University Teaching Hospital in Jaraba is one place. But most other general hospitals and teaching hospitals in Lagos and outside Lagos can actually be a good screening center.
Dr. Bolanle Adegboyega, consultant clinical radiation oncologist at the NSIA-LUTH Cancer Centre. Thank you so much for your time and expertise on ovarian cancer.
Thank you for having me.
All right.
Have a good evening.
You too, ma'am.
Bye.
Yes, I have been speaking with Dr. Bolanle Adegboyega, a consultant radiation and clinical oncologist at the NSIA-LUTH Cancer Centre with over 10 years experience of treating cancer patients, and she has been telling us how to beat ovarian cancer. Sound Health continues with trending health report from around the world. Please stay tuned. Well, this is where we say thank you on today's episode of Sound Health. Cancer is not a death sentence. If you're feeling unwell or experiencing any of the symptoms highlighted by Dr. Adegboyega, consult your medical practitioner early enough. In prevention, they say, is better than cure. For comments and inquiries, or you have topics you would like us to treat, we would like to hear from you. Send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.